It is emerging that the largest donor to Kenya's HIV and AIDS programs is scaling back on its funds to the country. The United States Presidential's Emergency Plan for AIDS Relief, pepfar, will soon focus on only 10 of the counties worst hit by HIV. As KTN's Wilkister Nyabwa reports, the move has alarmed beneficiaries of this program.
You don't take this when you're going to drive in the next 1 hour.
Easy access to antiretroviral medicines and support means a diagnosis of HIV no longer means death. But once patients start taking the drugs, they must remain on them for the rest of their lives. The idea that they may one day once again lack access is one many would not like to entertain. Dorothy Onyango can attest to the long journey it has taken to get to this point. When she tested positive for HIV in 1990, HIV was still a taboo topic, spoken of in whispers. Worse still, she and others had no access to antiretroviral drugs. The drugs soon came into the Kenyan market, but the cost amounted to 120,000 shillings for a monthly dose. This came down to 60,000 shillings, then 40,000 every month, but this was still beyond the reach of many.
I actually did not pay for my drugs. I was waiting for the day that the drugs would be free or would be affordable. I was just trying to live positively from the information I got from where I traveled, and you said you eat healthy, you avoid stress. So we were actually just gambling with our lives to ensure that we live until such a day that we will find the drugs cheaply.
It may have seemed like an unattainable goal, but in 2003, President George Bush lobbied for the creation of the President's Emergency Plan for AIDS Relief, commonly referred to as pepfar. It would channel hundreds of millions of dollars to Kenya and other countries, paving the way for millions of Kenyans to receive free ARVs. Today, out of 1 million Kenyans in need of ARVs, 640,000 receive the drugs at no cost from public health facilities. The government, together with a few donors, supports just 10% of these. The Global Fund supports another 20%, but the bulk of funding, 70% to be exact, comes from pepfar, and pepfar is scaling down in Kenya. In the 2013-2014 financial year, pepfar allocated Kenya $529 million to fund drug provision as well as support various programs. In the 2014-2015 financial year, Kenya will receive $460 million. Pepfar is now focusing on core interventions.
Those who have been tested HIV positive, they will support procurement and distribution of ARVs so that the people they've been supporting will continue to get that support in public health facilities and free of charge.
This means less or no funding for support programs such as sensitization of the public and community support. Further, after 2015, no more patients will be added to the list supported by pepfar. And that's not all. After 2015, pepfar will narrow down its programs to the 10 counties with the highest HIV burden. The list includes Nairobi, Kisumu, Mombasa, Nakuru, and Siaya. The move now sending a message to the government that in coming years it will need to play a greater role in ensuring the country does not take a step backwards. But will the government act?
Somebody has been supporting you for long, paying your rent and supporting your family. Even if they tell you one day we will stop, you think that they will not stop. So the reality has now dawned in that pepfar is cutting. They are not stopping, but they are reducing the support. It is a time to remind the government that even if pepfar was not there, it is the responsibility of the government of the day, whether national or country government, to make sure that people in their country are healthy.
Out of over 1 million people in the country who should be on treatment, it is estimated that just over 600,000 are receiving their ARVs. And with pepfar now scaling back funds, it is feared that the gains made in the fight against HIV and AIDS in the last 20 years may be lost. Wilkister Nyabwa, KTN in Nairobi.